En 2021, l'Alberta a enregistré l'année la plus meurtrière de son histoire en matière d'intoxication médicamenteuse, avec plus de 700 décès. Nombreux sont ceux qui ne s'accordent pas sur les moyens efficaces d'inverser la tendance. Mais un projet de recherche communautaire sur le cannabis pourrait apporter une partie de la solution. Les effets de la consommation de cannabis sur la santé mentale. Quelle était l'étude? Erika Lemont.
So we did this project to understand the experiences of people in the community who were in risk. So we defined that as people who were using substances or people who were living houseless. We tried to get people who had intersecting factors. So that's why we focused a lot on different community organizations that Aware had connections to, or finding people just out in the community. And so we did almost 200 surveys over a span of about like 4 or 5 months. So it would have been last year. And then we did about 20 interviews, 10 in each city, so 10 in Calgary, 10 in Edmonton.
Comment la recherche a-t-elle été menée? Lorraine.
Our perspective as peers, we already can connect with our community. We know a lot of the folks out there, the underinvested folks in the community, and know how to speak to them. And when we were creating the survey questions, we made a lot of changes. We're like, wait a second, we wouldn't speak to our community that way. That could trigger them, or it could cause them to think that we were unsafe, or that we weren't to be trusted, right? So we already built that trust in the community. Already doing street outreach, peer outreach, Tuesday to Friday, we're out in the street, handing out harm reduction supplies, advocating for our peers. When we come up and we ask, hey, do you want to do a survey? They're more receptive.
C'était ma façon de réduire les risques quand j'étais dans la rue. Je ne dormais pas beaucoup dans les rues. Quand je voulais me détendre, je fumais du cannabis. Participant à l'entretien Karma. Teresa.
To really make people feel comfortable, a lot of the questions were based on what that experience would be like, because when you're houseless, there's a lot of trauma that comes with that. You can get robbed, beat up on a daily basis. There's just refused access to all kinds of places. And really, how do you feel safe when you've been experiencing that for years and years?
Cody.
We didn't really single out any type of demographic. It was more random. Just, we tried to equal out the gender, whether it be someone with different pronouns, or she, her, he, him, or they, them. Give us more information on different demographics. We try to do one-on-one because a lot of the information that they're sharing is pretty private, and we want to be more intimate with one-on-one. If a person's houseless and they have no food, at the end of the survey, they would get a gift card. So it's a win-win situation. They help us. They help policies and practices. They help out maybe changing something maybe in the government. And also it helps them support themselves. Maybe put some food in their belly, or maybe get some toiletries or something, for themselves, right? So. And the smile on their face is priceless, right? After they're like, wow, I wasn't expecting this.
Je me sens plus à l'aise lorsqu'une personne comprend ce que je vis, lorsqu'elle a vécu une expérience similaire à la mienne. Je me sens plus en sécurité. Participant à l'entretien Karma.
So that's a big thing about peer research, is you do have to integrate a lot of additional support. Which I think is just really important for the project and to develop rapport with the individuals. A big thing with community research is you don't just want to come in and do the research and leave. I feel like I have developed relationships with the people, people that today, people in Edmonton, through this project, and I think that's a very important component of community-based research.
Quels sont les premiers résultats de la recherche?
A good percentage of folks were saying they started marijuana just to help cope, just to cope with their mental health issues. It wasn't on the survey, but a lot of them were using marijuana as harm reduction from opiates and meth, and basically just to cope on a daily basis.
And so what I noticed, themes that developed for myself, is the cannabis as harm reduction. So similar to what the peer researchers have said about utilizing it to come off other substances, that definitely was very prevalent.
Si je vois des personnes adopter un comportement autodestructeur avec des substances plus dangereuses, je leur suggérerai toujours une stratégie de réduction des risques, par exemple, d'essayer des drogues plus douces comme le cannabis. Participant à l'entretien Karma.
People need to be more aware that, mental health and marijuana is a huge issue, right? And, and marijuana is not a barrier.
Projet de recherche communautaire de la AWEAR, Habitus et le University Calgary. La Commission de la santé mentale du Canada. commissionsantémentale.ca. Les points de vue exprimés dans le présent document représentent uniquement ceux de l'équipe de recherche. La production du présent document a été rendue possible grâce aux travaux de recherche sur le cannabis et la santé mentale de la CSMC et à la contribution financière de Santé Canada.